What every diabetic should know about metformin. Metformin is a common medication often prescribed for individuals diagnosed with type 2 diabetes. Its primary role is to reduce the production of sugar or glucose by the liver while combating insulin resistance. Insulin resistance occurs when the body fails to respond adequately to insulin, which is essential for utilizing glucose as energy in cells. Think of metformin as a reliable friend who always comes through when needed. It's often among the first-line treatments for type 2 diabetes due to its proven safety and effectiveness. An added bonus is that it typically doesn't lead to weight gain, unlike some other diabetes medications. If you or a loved one are managing type 2 diabetes, metformin may be an integral part of your treatment plan. Let's look at how to use metformin. The dosage of metformin varies based on the individual's health condition, age, and the presence of other health complications. Usually, if you're an adult with type 2 diabetes just starting on metformin, you'd begin with around 500 milligrams, that's a common pill size, twice a day, or perhaps 850 milligrams once a day. You take it with meals because that can help to reduce side effects. Then as time goes on, your doctor will see how your body's doing with the medicine and might tweak your dose. They're trying to find that sweet spot where the medication is doing its best work without causing you unnecessary side effects. The maximum daily dose for adults is usually around 2,000 to 2,550 milligrams, depending on the specific kind of metformin. Oh, and there's also an extended release metformin that you take just once a day, typically with your evening meal. It starts at about 500 milligrams a day, and your doctor can slowly increase it if needed, up to a maximum of 2,000 milligrams daily. For children aged 10 years and up, they typically start with 500 milligrams twice a day, taken with meals. This pediatric dose can be increased every week by 500 milligrams up to a maximum of 2,000 milligrams split into separate doses. But remember, these are just common practices. It's super important to follow your doctor's instructions when it comes to how and when to take metformin. Don't play around with the dose or stop taking it without chatting with your doctor first. What are the possible side effects of metformin? When it comes to metformin, it's important to be aware of potential side effects. The most common ones are related to gastrointestinal discomfort. Initially, you may experience indigestion, nausea, or diarrhea. Fortunately, these side effects often diminish over time as your body adjusts to the medication. Another aspect to note is that long-term use of metformin can lead to a vitamin B12 deficiency. Although this is relatively uncommon, your doctor may periodically check your B12 levels as a precautionary measure. It's crucial to be aware of a rare but serious side effect called lactic acidosis, which involves the buildup of lactic acid in the body. While it is not common, the risk may increase if you have kidney problems, heart failure, or consume excessive alcohol. Symptoms of lactic acidosis include fatigue, unusual muscle pain, difficulty breathing, stomach pain with vomiting, feeling cold in your limbs, dizziness, lightheadedness, or an irregular heartbeat. If you experience any of these symptoms, seek immediate medical assistance. However, it's important to remember that lactic acidosis is rare, as everyone responds differently to medications. It's crucial to inform your doctor about any side effects you experience. They can provide guidance on managing them and determine if metformin is the right choice for you. Drug interactions. Ensuring that all the medications you take work well together is essential. Some diabetes drugs, such as insulin and sulfonylureas like glipizide and glyburide, can potentially lower your blood sugar too much, leading to hypoglycemia. While it's possible to take these medications alongside metformin, your doctor will need to closely monitor your blood sugar levels to maintain the right range. On the other hand, certain medications can raise your blood sugar levels, counteracting the blood sugar lowering effects of metformin. This includes diuretics, steroids, and certain blood pressure medicines. It's also important to note that specific medications can increase the risk of lactic acidosis, the rare but serious side effect we discussed earlier. Medications for heart disease, kidney disease, or HIV fall into this category. Additionally, over-the-counter medicines, supplements, and herbal products can potentially interact with metformin. Whenever you start a new medication, inform your doctor or pharmacist about all the medications, supplements, and vitamins you're currently taking. They are best equipped to ensure that all your treatments work together harmoniously, minimizing the risk of any unwanted surprises. Precautions. Taking precautions while on metformin is crucial. First and foremost, regular blood tests are important to monitor how well metformin is managing your blood sugar levels. These tests also help assess vitamin B12 levels, considering the potential for deficiency. Keeping your kidneys in check is vital because metformin is processed by the kidneys. Regular kidney function tests are typically performed before starting metformin and throughout its usage. It's essential to be mindful of alcohol consumption, as excessive drinking can increase the risk of lactic acidosis and disrupt blood sugar control. Moderation is key. Additionally, it's crucial to inform your doctor if you have any medical procedures or surgeries scheduled, including dental work. There may be instances when temporarily stopping metformin is necessary. Finally, remember that taking metformin doesn't mean you can neglect healthy eating habits and regular exercise. A balanced diet and physical activity remain crucial components of managing diabetes effectively. By following these precautions, you can optimize the benefits of metformin and enhance your overall well-being. Watch this next video on natural ways to manage your diabetes.